Hi, Dr. Fauci. Charles Benson here in Milwaukee. It is a pleasure to get a chance to talk to you.
Same here. Very nice to meet you, Mr. Benson.
Nice to meet you as well. We are ready to go. So, Dr. Fauci, thanks for making time to talk to us. There are a lot of timely issues I want to address, and let's start with President Biden recommending the COVID booster shots. Why now? What changed for those who thought they were fully vaccinated?
Well, what changed is that if you look at the durability of the protection in the context of this highly transmissible Delta variant, we were starting to see literally only recently, I mean, that gets to your point of why now, that there is an attenuation of the protection against infection and mildly to moderately severe disease. What has held true and strong is the protection against severe disease leading to hospitalizations and deaths. But if you look at the same phenomenon from certain other cohorts, like in Israel, which we seem to be following the pattern in many respects in Israel, that they're already starting to see not only an attenuation of the durability of the protection against infection and mild disease, they're starting to see, particularly among vulnerable people such as those in nursing homes, that they are seeing an increase in severe disease leading to hospitalizations. So what we want to make sure we do is that we're not chasing after something that might inevitably happen, and we want to stay ahead of the virus. And the way you do that is to take a look at the dynamics of what's going on and get people vaccinated at a period that's a reasonable period from the time of their first vaccination to increase the level and the durability of protection. And we know from experiments, clinical trials that we've done, regular clinical trials, that when you give a booster to someone several months after they have their primary regimen, and with an mRNA, that would be one dose followed in 3 to 4 weeks by another dose, you dramatically increase the level of antibodies that are a good marker of protection. And in fact, a report today from Israel has shown that they have already been boosting people ahead of us, and they're seeing a favorable effect in protection. So we want to stay ahead of the curve and not be chasing after and responding to something bad that's happening. We want to prevent it from happening.
Well, speaking of staying ahead of the virus, about 50% of Wisconsin is fully vaccinated. It jumps to about 61% for 18 and older. As health professionals pivot to administer a third dose, are you concerned it will take away from their efforts to get people their first shot? For example, Milwaukee's mayor says the city has been going door to door to reach the unvaccinated. That's labor intensive.
Yeah, and thank you for that question. I want to make sure we make it very clear to the people of Milwaukee. The most important thing that we need to do is to get the 90+ million people in this country who are eligible to be vaccinated, who have not yet gotten vaccinated. That is the critical issue. For those who have been vaccinated, you're well protected now. We're talking about a boost to prevent you from getting that attenuation of protection and to keep your protection high and durable. So you don't want to confuse those two. This should not interfere at all with the purpose of getting the unvaccinated people vaccinated. That is critical.
At the beginning of July, Wisconsin reported about 175 children had contracted the virus. By August 1st, that number had jumped to 1,300. It has since trended down a little, but Milwaukee County health officials and professionals are worried kids are becoming a bigger proportion of new cases, about 1 in 5. As schools reopen, Dr. Fauci, is a surge among kids going to be an unavoidable reality, or can it be prevented?
You know, it can be prevented. And the one thing there are a couple of things you do. You surround the children with people who are eligible to be vaccinated and who are in fact vaccinated. I'm talking about teachers. I'm talking about personnel who come into contact with the children in the school system. We've got to make sure they are vaccinated to provide that veil of protection. For the children in school who are old enough so that they are eligible to be vaccinated, we want to try as best as we can to get them to be vaccinated. They are under vaccinated as a group. And for the rest of the children, we really want to keep them in school physically present in class because we are well aware of a now well over a year and a half of experience of the deleterious effects on social and mental issues with the children when you keep them out of school. And you do that by looking at and complying with and listening to the recommendations of the CDC, which means that in the school system, everyone should be wearing a mask. That is what we can do to keep the children safe at the same time we keep them in school.
Dr. Fauci, we are still seeing hesitancy and equity issues as roadblocks for African Americans. Less than 38% are fully vaccinated in Wisconsin. One local pastor telling us trust is still a big issue. Are more national resources needed to decrease barriers and increase confidence in the vaccine?
There are a lot of national resources going into that. We have a very strong equity program that has an equity task force that reaches out into the community to try and get people, any people, but particularly brown and black people who might have concern, and in some respects, understandable concern, to get trusted messengers that can reach out to them and get the proper information to them. Because a lot of the hesitancy is really based on some misinformation or disinformation. But you want trusted people. They could be clergy members, they could be family physicians and healthcare providers, they could be sports figures or people that the community trusts. Those are the things that we're trying to do. It's very, very important because brown and black people suffered disproportionately from this outbreak with regard to severe disease, hospitalization, and death.
We have time for one more question. I want to talk about children as well again and schools reopening. We do hear from some parents who believe it's unlikely their kids will get COVID, and if they get it, they won't get really sick. Do you think the Delta variant has changed that calculation?
You know, it certainly has, because all you have to do is look at pediatric hospitals in different cities that have a high level of infection. There are children in there are children in intensive care units. So this idea that don't worry about kids, it's going to be okay, they can get infected or they don't get infected and they don't spread, that's been turned upside down right now. We really got to do everything we can to keep the children safe.
Dr. Fauci, thank you very much for your time.
Good to be with you. Thank you for having me.
Have a good day.
You too.